Hi, I'm Dennis Lunt. I am Assistant Professor of Philosophy here at BSU. I've been here for 6 years. I got my PhD from Southern Illinois University, Carbondale. I specialize in ethics and political philosophy, and I especially enjoy studying human rights, conscience, dissent, protest, and all those fun settings where people say no. I've titled my lecture Refusing Care, Conscientious Objection in American Healthcare, and this deals with a very thorny subject in medical ethics. On the one hand, medical professionals have the right to make informed and moral judgments about what care they're willing to give patients. And sometimes that means saying that this care is not a good idea, maybe for practical reasons, but also for moral reasons. They might say, I don't believe in this care. This is wrong. And it's important to protect that right. On the other hand, patients have a right to adequate health care. They have a right to make informed and even powerful decisions about who they want to be and how they want to be cared for. And making those two rights work together is difficult. So I'm going to be suggesting one way that we can square that circle, respecting and honoring the rights of physicians without compromising the rights of patients. I've always been interested in conscientious objection. I love studying those moments when someone says, I can't do this or I won't do this. I'm especially interested right now because federal policy on conscientious objection in healthcare is changing rapidly. So right now there's expanding right for doctors to refuse care to patients. Increasingly they're being allowed not just to pick the kinds of procedures and treatments they want to offer, they're being allowed to pick the patients they want to care for. And that's a pretty substantial development in medical ethics. And one that I find somewhat problematic, especially in a rural area like ours. I'd like students to first of all, appreciate just how difficult it is to make informed moral decisions in the medical context. We have to make tougher and tougher decisions in healthcare. I don't think it's something to be scared of, but I think it is something to be prepared for. And a lot of our students are going to be involved in providing that care. And I hope people show up prepared not just to listen, but to let me know what they think and help me identify what's right and what's wrong with what I'm coming up with.